The acronym of the day is
SEP.
SEP, your opportunity to make a change. I guess that's a fair way to say it.
It's kind of like your golden ticket to get into Wonka's. It's like, dude,
yeah.
if, without the golden ticket, you can't. Sorry.
You don't have to eat 100 chocolate bars to get an SEP, but there are roughly over 30 different things.
There's a lot of different SEPs, the ways that you can qualify for making a change when it comes to Medicare. But you know what, though? I mean, there's a lot of others.
What was the one other that we don't even want to go down that path. We'll come back to that at the very end. Welcome to episode 6 of the Brad and Mike Show.
Smiley faces, just for you.
Indeed.
We go.
So today's episode.
Yes, today's episde. What are we going to do?
Well,
are we cooking something today?
Yeah, we're cooking with.
Are we making recipes?
We're cooking with acronyms today. In Medicare, there is no place where acronyms are best suited or prevalent, I should say.
Yes.
There's an acronym for everything. In today's acronym, the acronym of the day is
SEP.
SEP, Special Enrollment
Period.
What is an SEP? And SEPs are your opportunity to make a change. I guess that's a fair way to say it.
It's kind of like your golden ticket to get into Wonka's. It's like, dude, if without the golden ticket, you can't. Sorry.
You don't have to eat 100 chocolate bars to get an SEP. But there are roughly over 30 different things.
But Daddy, I want an Oompa Loompa too. There's a lot of different SEPs, the ways that you can qualify for making a change when it comes to Medicare. Because what ends up happening is not everybody in this world basically that has a plan, and it's all you're good to go. You never need to make a change. Everything's right. No changes ever happen. That doesn't happen. It just doesn't, because once you age in, so like you're
that is the grandfather of all SEPs.
That is correct.
Aging into Medicare, turning 65 is your very first SEP.
I am new to Medicare.
I am new to Medicare, and that's your first special enrollment period. That's when you enroll in Part A and Part B. You can pick up a Medicare supplement plan or a Medicare Advantage plan. If you pick up a supplement plan, you're picking up a Part D drug plan as well. That time frame is the first SEP. But there are many more from there.
Oh, yeah. Well, that's the typical one that most people have, right?
Yeah.
Right out of the gate.
Everybody's got that one.
Yeah. I mean, pretty much everybody will have that one turning 65. That's your main one. But you know what, though? I mean, there's a lot of others. So, I mean, we basically have kind of just printed out a handful of different ones. Just
again,
because,
as I mentioned, there's 30 different plus other. And what was the one other that we don't even want to go down that path just yet. Let's talk about
other. Not other.
No, not that one.
Not that one.
No.
Okay.
We'll come back to that at the very end. I've already have hospital Part A and have recently signed up for Medicare Part B. I want to join a Medicare Advantage.
This is pretty typical of people that may have actually continued to work after age 65. So they may have signed up for Part B.
And these days, people are working way past 65.
Oh, yeah. Way.
I run into people all the time saying, I'm never going to retire. I'm like, hey, to each their own.
It's like the opposite of Peter Pan.
It is.
I'm not going to grow up.
Right. It's true. So you have decided to keep working past age 65.
Yep.
You did enroll in Part A, but you did not enroll in Part B.
Yep. So basically at that time.
And why is that? Why wouldn't you enroll in Part B, Mike?
Yeah. Let's say you have health insurance through your employer. That's going to be taking care of your situation for you as far as your medical insurance. But the other big part of it, though, too, is that why people don't necessarily pick up Part B is because of that premium. And that premium, they're going to continue to pay for it. So if you're at work and you're paying for your health insurance, why do you want to pay for the other part of Part B?
Though we do get calls all the time when people are finally working the math and saying, you know what, I think it might be better economically for me to drop my employer's health insurance and go on Medicare Part B.
Oh, yeah.
And we get those calls all the time.
Yeah, because it makes sense. I mean, when you kind of...
And you just got to work the math. You've decided that you're no longer going to keep your employer's medical insurance and you're going to opt into Medicare Part B.
Yes, or you could be fully retiring. So maybe you're 67, 68, and you finally got to that point and you're like, hey, I want to start drawing my Social Security now. No problem. Okay, you're done working.
That's it.
Bring it in. And basically that's going to be your SEP. So basically that you had enrolled in Part A, now you're newly eligible for Part B. Recently moved outside of the service area for my current plan, or I recently moved and have new options available to me. So basically, this is going to be a big one. So if you're
especially
moving
for people who are retiring and they're going to move to Arizona, they're going to move to Florida, or in certain circumstances, people move from Arizona to Michigan. It could happen.
Well, it also can work where if you're moving from one county in Michigan to another, or wherever you may be, because you may have bought that home, in northern Michigan, and it's like, you know what, we're going to sell this spot because I want to live back in upper Michigan.
I want to move up north.
And so that's basically moving from one service area
Which, by
to
the way,
another.
just as a caveat, up north is anything above the Zilwaukee Bridge. I'm just saying.
Oh, that's your rule.
That's just my rule of thumb. If it's not above the Zilwaukee Bridge, it's not up north. That's how I roll.
Is that how you roll?
That's how I roll.
Okay.
Yeah.
Did you put pen to paper on that?
I did. Check that off. Absolutely.
It's important, though, when you move. I mean, especially if you have, let's say, like a Medicare Advantage plan, because in many cases, they're going to have specific networks in those plans. And if you don't have one of those ones that has a nationwide network, you're going to be out of network. And so you really need to be able to make that change. So that's going to be another SEP for people to make that change because you moved. Hey, look, my doctors aren't here. I got to get new doctors. Well, it makes sense. Well, you want to make sure you find one with your doctors in network.
And here's another one. I recently returned to the United States after living permanently outside the U.S. I returned to the U.S. on date, and that is an SEP.
That's an SEP because you get a lot of people that have dual citizenship right now. They may spend time in a different country for however long and that type of stuff. Well, you move back to the United States. Well, okay. Well, what happens then? What do I do? How do I help?
You've got an SEP.
You got an SEP.
At that point, again, depending on where you're coming, obviously, if we're talking to you, it's very likely that you're living here in Southeast Michigan. And I tell you, we do see that, especially in the automotive industry.
Yes.
We do see that quite a bit. People live overseas because there happens to be a manufacturing facility or they're a tier 1, tier 2, or tier 3 supplier, and they've got a headquarters in another country, and then they come back. All right, check that one off.
All right, so basically, I recently had a change in my Medicaid. So newly got Medicaid, had a change in level of Medicaid, assistance, or lost Medicaid. So this is going to be a big one,
So what's the factor that drives this?
It's income.
It is.
It's income.
It's income. Income is a deciding factor in this. And again, if you've retired, your income changes.
Sure it does.
So there are a lot of forces that drive this particular SEP.
Oh, yeah.
And
absolutely,
people sometimes are right on that edge and they're dipping below or dipping above. Up or down, you cross that line, you've got an SEP.
There's going to be certain programs that you can qualify for if you're new to Medicaid, or at the same time, if they say, hey, look, you know what, you're doing much better with regards to your annual income. We're going to move you off of Medicaid. Well, okay, well, what do I do now? Now you need to do something because prior to that, you had the Medicaid. Now you know
what you got to do? You got to call Brad and Mike.
Yeah.
And by the way, like and subscribe to this podcast. I have to throw that in there because we were told by our
pen to paper.
Check that off. I recently had a change in my extra help paying for Medicare prescription drug coverage. Newly got extra help. Had a change in the level of extra help or lost extra help.
Again, income.
Yes.
So
that's the deciding factor here.
That's really the key in all of this is whether or not you qualify based on your income. And that's really going to be the key. So if you're eligible for it, by all means, get the extra help. If you're not, then you're not. But that's really what you have to look at. I mean, if you qualify based on what the rules and regulations are for extra help, by all means, get it.
And let's be clear. We don't expect you to know what the guidelines are. That's why you got to give us a call and help us walk.
So extra help isn't you helping make clean my car and stuff like that?
No, it's not.
No.
I don't know where you got that, but no.
I was just thinking, extra help, please.
No. Let's move on down the list.
I'm leaving my employer a union coverage. So yes, another one. So basically this kind of goes back to.
We kind of touched on this a few minutes ago, but.
Yeah, basically, hey, look, you had coverage through your employer, you no longer do. So you lost coverage. You need to pick it up at that point in time. So that is an SEP.
Truly these days, we're seeing more and more people work past age 65. The age in for Medicare, Part A and Part B is 65, but we're seeing more and more people continuing to work for whatever reason. Maybe you just love your job. Maybe you need the money. Whatever the reason is, people are staying on their insurance through their employer a lot longer. When that changes, that is an SEP.
That's right.
Yep. I was enrolled in a special needs plan, a SNP plan, but I've lost the special needs qualification required to be on that plan. Mm-hmm. I was disenrolled from the S&P plan, the SNP plan. So is that an SEP?
That's an SEP. So a little bit about what SNP plans are. They're special needs plans. So
what is a special need?
So a special need could be a thing like that you are a diabetic, for instance.
Could be.
That's
very common. That's very common.
Yep. So it could be that you're dealing with that. It could be heart issues that you're actually dealing with at that point.
What about kidney issues?
Yeah, kidney issues are another big one as well. So
very common.
So with those being the case, you may qualify for a plan that deals specifically with those. It's not that they work completely different, but there's a lot more help that you receive from providers, a lot more access to different things that, at the end of the day, it doesn't become a situation where it completely changes the Medicare Advantage plan, let's say, that you do have. It's more so to say that you're going to get some extra guidance, you're going to get some extra help from the carrier at that point in time of dealing with your condition.
Yes, depending on your health. That's what it comes down to. There's one that we didn't have marked, but I'm going to read it anyhow because this one I love that this is a special needs.
This is near and dear to your heart.
I'm in a plan that has a star rating of less than 3 stars for the last 3 years. I want to join a plan with a star ratings of 3 stars or higher. That is a special enrollment.
That's a special enrollment.
If you happen to be on, and usually when we see this, it's a national carrier, not to disparage any of the national carriers, but oftentimes these plans get a lower star rating in the systems, in the CMS platform, and some of the more local plans have higher, 4 stars and higher, and people move. And that's a special enrollment period.
Really, when you look at it, that's one of the things that we've not touched on is that the star ratings. So every single plan
has a
star rating. And that realistically, it's out of 5 stars. How good the plan is doing.
This rating is aggregated by the feedback they get from the people
word of the
who are
day,
actually on the
aggregated.
Word of the day.
Is it aggregated? Look it up.
Have that on my
Google that.
card.
No.
Yeah.
I was affected by an emergency or major disaster as declared by FEMA or by the federal, state, or local government entity. One of the other statements here applies to me, but I was unable to make my enrollment request because of the disaster. So this is one that really kind of comes into play that you do see if there is kind of a natural disaster, maybe in the middle of open enrollment. So like AEP rolls around and that's only from October 15th through December 7th. Well, if something really bad happened and you had every intention of doing an enrollment, but it was going to be towards the end. And next thing you know, this hits December 1st, rolls around, and there's no way based on what just occurred for you to be able to enroll because of this disaster. Well,
where you would see that is if you were in a coastal city, which is probably more common.
Well, yeah. If there's an earthquake, if there's a hurricane, if there is, think about it in those terms. You're going to have a FEMA event basically, or some type of level where the state's going to say that it's a natural disaster. And it could just be in your small little area defined to 1 zip code or 2 zip codes or to a county.
That's true. It could very well be. You bring up a good point because on occasion, some rogue tornadoes touch down.
Yes,
and,
spot on.
And they wipe out, or damage greatly a particular zip code. So I suppose that probably is more common than maybe even I thought.
Oh, but not so much the hurricanes here.
Yeah, not so much. I have Medicare and I get full Medicaid benefits. I want to join or switch to a plan that coordinates coverage between my Medicare and my Medicaid managed care plans called an integrated dual eligible special needs plans or a DSNP.
Mm-hmm. Yep, precisely. So with this one being the case, this is where you're on Medicaid. And the state of Michigan here is basically moving over to a new structure where they're making the carriers align Medicaid and Medicare. So basically, instead of you being able to have a plan from one company, let's say carrier A, that handled your Medicaid, and then carrier B that handled your Medicare, they're making it now where carrier
Mesh up nicely together.
A and B no longer can exist. You have to have the same one. And so that's important because then that actually gets you a better situation where they're able to bill it correctly. They're able to keep an eye on it, and pay for it correctly. The reality is that you don't get lost in the system between Medicare and Medicaid at that point in time by having one carrier do all that for you.
And one of the common themes that drives a lot of these is income. Income dictates oftentimes, the trigger, if you will, of your special enrollment period. And certainly that is the case here as well.
Yes. And then to other. So other basically kind of comes into play where maybe you may have received bad information. Now,
wait a minute. You were misled.
You were misled.
Shut the door.
Shut the door. The door is shut.
It is.
But the whole thing is that you may have been misled by somebody from a carrier. Maybe it could have been, somebody in the business, but it's done on a case-by-case basis. It's not just, hey.
It's not just that you say, hey, I wasn't told this. You're going to have to be able to substantiate your claim.
Well, the other part of it, though, too, is that, when done correctly, if you've done this over the phone or you've done it online enrollment-wise, it's going to be recorded.
That's correct.
So that information is going to be out there that basically says, the agent didn't say this. Basically, CMS, which is the Center for Medicare and Medicaid Services, can say, all right, agent, give us a copy of the phone call.
Which is why we have the lines that we have people call in on with regards to Medicare are always recorded.
Yep, has to be.
Yeah,
has to be by law in regards to that. So, but that's the whole thing, and that's where other comes in it. So it's an other one. But it's case-by-case basis. Right. It's not just because I don't like your other. That's all.
Those are the special enrollment periods.
Some of them.
Some of them.
Some of the SEPs.
There are others, but they're really quite, I don't want to say rare, but not so common is a better way to say it.
But at the same time, give us a call. Call us, hit our website.
If you think you have an SEP or any other acronym that you want to talk about, just give us a shout. Give us a shout and we'll chat.
SEPs. Well, that's the acronym of the day is SEP. So
I did have that on my bingo card.
You did. You had SEP. Good. Yes. That's good. All right. Well, hey, I appreciate everybody tuning in here today. And until next time.
Subscribe and like. Next time, Brad and Mike.
For your benefits done right. I'm Mike Ritter.
I'm Brad Bachman.
Take care, everyone. Bye-bye.
Thanks again.